Valerian, also known as all-heal or garden heliotrope, is a flowering plant native to Europe and parts of Asia. Since ancient times, the root of the plant has been used to treat insomnia, nervousness, trembling, headaches, and heart palpitations. In the US, valerian root is mainly sold as a sleep aid, while in Europe it's used to treat restlessness, tremors, and anxiety. Valerian flowers have a delicate scent, and they were once used in perfumes. Valerian root, however, has a very strong, earthy smell. This is because of the volatile oils and other compounds responsible for its sedative effects. There's over 250 species of valerian, but Valerian officinalis is the species most used in medicine. Valerian consists of many biologically active components that account for its wide range of effects. Valerian's chemical composition can vary greatly depending on the species, the season, the geographical source, the growing condition, the processing method, and the storage. Some of the main chemical active components of the valerian are the essential oils and some of the alkaloids. Valerianic acid increases levels of Gaba, a neurotransmitter that reduces brain cell activity. It also has anti-inflammatory effects. Iridoids have sedative effects, but are unstable and they break down during storage or in water, making their activity difficult to assess. Isovaleric acid prevents involuntary muscle contractions. Its action is similar to valproic acid, which is used to treat epilepsy. Hesperidin and linearin are antioxidant flavonoids with sleep-enhancing properties. Hesperidin also has anti-seizure effects. Gaba is also found in valerian extracts in quantities sufficient to cause a sedative effect, although it's not known whether it crosses the blood-brain barrier. However, the glutamine present in water but not alcohol extracts of valerian root can cross the blood-brain barrier and be converted into Gaba. Although its influence on the Gaba system is well documented, valerian has many other modes of action which can contribute to relaxation and other health benefits. It activates adenosine and serotonin receptors. It inhibits prostaglandins responsible for painful contractions. It can relax blood vessels. It can reduce the stress hormone cortisol, and it can suppress inflammation through NF-kappa B activity. Valerian's mild sedative effect has been used to promote relaxation and sleep for at least 2,000 years. Valerian can improve sleep by increasing GABA levels. In fact, lower GABA levels are found in people with short and long-term stress, and they're linked to anxiety and poor sleep quality. A meta-analysis of 16 studies and 1,093 people found that valerian improved the speed of falling asleep, the depth and the overall quality of sleep. In a 2-day study of 27 elderly patients with mental health problems, 44% reported perfect sleep and 89% reported improved sleep while using a valerian preparation containing the sesquiterpenes. Additionally, a 1-month-long study of 16 people with insomnia found that a single dose of valerian improved the time to achieve a deep sleep and its duration. Valerian can also help to reduce sleep disturbances in a variety of health conditions like rheumatoid arthritis, menopause, hypothyroidism, PTSD, HIV, fibromyalgia, and benzodiazepine withdrawals. In a study of 100 menopausal women with sleep disturbance, valerian root significantly improved the sleep quality after 4 weeks. A 3-month study of 60 postmenopausal women found that valerian significantly improved the severity and the frequency of the hot flushes. Valerian is known as nature's Valium because it supposedly has a similar effect at reducing anxiety as the benzodiazepine, Valium, and Xanax. These bind to GABA receptors in the brain, in the amygdala. One study of 2,462 adults with major depressive disorder and anxiety found that high doses of valerian, 1,000 mg per day, taken in combination with St. John's wort at 600 mg per day for 6 weeks reduced the symptoms of anxiety and depression by 66%. Some researchers noticed that mice who were treated with valerian and valerianic acid exhibited a decrease in anxious behaviors. In a study of 27 patients regularly kept awake at night by stress-inducing thoughts, 89% of those patients had better sleep after 1 month of valerian treatment. Valerian can also reduce physical reactions during stressful situations. It slowed the heart rate and reduced the blood pressure in response to stress in a 2-week study on 56 healthy people. A 4-day study of 24 healthy volunteers found that a combination of lemon balm and valerian improved lab-induced stress scores at 600 milligrams when compared to a placebo, but it increased anxiety at a higher dose of 1,800 milligrams. Valerian reduced physical and psychological stress in rats by maintaining serotonin and norepinephrine levels in the brain regions associated with fear and anxiety, the hippocampus and the amygdala. In mice, valerian reduced blood levels of a hormone involved in stress response. Valerian increases Gaba in the brain. Deficiencies in Gaba play a role in anxiety, restlessness, and obsessive behavior, and these are symptoms often seen in ADHD. In a study of 30 children aged 5 to 11, valerian 3 times a day for 2 weeks improved the ADHD symptoms, such as sustained inattention and impulsivity and/or hyperactivity. These positive effects disappeared 1 week after discontinuing the valerian use. In a 7-week study of 169 children with hyperactivity and concentration difficulties, but not meeting the ADHD criteria, the combination of valerian and lemon balm decreased the symptoms of restlessness, concentration difficulties, and impulsiveness. Similarly, in another study of 918 children under 12 with difficulties falling asleep and restlessness, a combination of valerian and lemon balm improved the symptoms in 81% of the patients with insomnia and 70% of the patients with restlessness without any negative effects. Because of this, it's commonly used to treat uterine cramping associated with painful menstrual cramps or dysmenorrhea. A 3-day study of 100 female students found that valerian was effective in relieving menstrual cramp when compared to placebo. An 8-week study of 227 patients undergoing cancer therapy did not support the use of valerian for insomnia, although fatigue was reduced. Additionally, in a review, valerian improved insomnia and well-being in people who were undergoing treatment for cancer due to its calming effect. Contrary to popular belief, it did not interact with the cancer drugs. The drug efavirenz used in HIV patients is known to impair mental health and cause psychiatric disorders. In a 4-week pilot study of 51 HIV-positive patients, valerian root reduced insomnia and anxiety, but it failed to reduce psychosis and suicidal thoughts. In a study of 61 patients, valerian reduced the risk of cognitive decline a month after surgery compared to placebo. Scientists observed the potential of valerianic acid to significantly improve memory by reducing oxidative stress in the memory center of the brain, the hippocampus. A valerian bath 3 times a week for 3 weeks significantly improved well-being and sleep and decreased pain in 30 people with fibromyalgia. In an 8-week trial of 31 adults with OCD, valerian root reduced the OCD symptoms when compared to placebo. Valerian is used as a home remedy for stomach cramps. Although it can reduce muscle spasms, current evidence does not support the use of valerian as a digestive aid. In a study on guinea pigs, essential oil present in valerian reduced contractions in the small intestine. An 8-week study of 37 healthy people with restless leg syndrome found that valerian significantly improved the restless leg syndrome symptoms and it decreased daytime sleepiness. In test tubes, valerian strengthened blood vessels and it improved their elasticity. In animal studies, researchers examined its potential to lower blood pressure or hypertension by relaxing blood vessels. Valerian reduced the frequency of seizures in one study on rats, possibly by activating adenosine receptors. In rats with high cholesterol, valerian protected against kidney damage caused by a high-fat diet. Valerian is used as a home remedy for shin splints or medial tibial stress syndrome. Anecdotal evidence suggests that drinking valerian tea relaxes the muscles and reduces pain. People with sciatica take valerian and they report some pain relief. This can be due to its muscle relaxing effects. Valerian can reduce hand tremors through its anti-anxiety effects. Valerian is traditionally known to decrease heart palpitations. It may do this by its relaxing effects on smooth muscle. The sedative effect of valerian can improve depression in bipolar disorder. Valerian illustrates both negative and positive aspects of herbal drugs. The variability in its composition and the stability of some of its chemicals can make standardization difficult. No information is available on the long-term safety of valerian or its safety in children under the age of 3, pregnant women or nursing mothers. Valerian is likely safe when it's taken for 4 to 8 weeks by healthy adults at recommended doses. Long-term safety data is not available. In rare cases, it can cause mild side effects like headaches, digestive upset, excitability, dry mouth, thinking problems, and strange dreams. Valerian has been classified as generally recognized as safe in the United States. People with allergies to plants in the Valerianaceae family may be allergic to valerian. Medical reports link the overuse of valerian to liver toxicity and addictiveness. At high doses, daytime drowsiness can occur, and caution is advised while driving or operating machinery. If you need surgery, stop taking valerian at least 2 weeks ahead of time. The valerian may increase the effects of anesthetics that act on the Gaba receptor. Heart problems and delirium might occur if valerian is stopped suddenly. At high doses, excitation can occur in some people. Animal studies and anecdotal reports suggest that valerian can increase both beneficial and side effects caused by sedative drugs. Examples include benzodiazepines, barbiturates, narcotics, antidepressants, antihistamines, alcohol, and anti-seizure drugs. Doses of valerian can range from 400 to 450 milligrams in insomnia clinical trials. Doses were taken 1 to 2 hours before bed, or up to 3 times in one day. Once sleep improved, the treatment continued for 2 to 6 weeks. Recommended doses of 400 to 900 milligrams at bedtime have also been used. Valerian is most effective if taken regularly for 2 or more weeks. It may take a few weeks before the effects of valerian root supplementation are noticed. Higher doses may have a stimulating effect, so it's best to start with a minimal dose and use the lowest dose possible to achieve the desired effect. For more information about herbs, supplements, or natural treatments, check out my website.